You know what show we've not been watching? The Good Fight.
Oh, yeah. I thought it was over. No?
I saw a commercial for it today.
Okay, yeah, we need to finish that.
Help me with questions, too.
Okay.
I don't have any spicy questions.
They don't need to be spicy.
Okay.
They're questions.
Good.
Reasonable.
Thank
Health questions.
Literally
I like
questions.
I literally want to know how her back is.
Yeah, well, I can help you answer that. My back was killing me before I had a
But
reduction.
and she's super fit, though. Like, she's super strong.
So her core is probably, which my
Yeah.
core was not, and my core is still isn't. My core sucks.
I wonder how large your breasts were prior to surgery.
Good question.
36 triple D.
Prior to?
Hmm?
Prior
Oh,
to?
prior to. I don't know.
So much for my fun talking about pre-surgery.
And I wonder if she had to wear stretchers to get enough skin to.
That's something that I need to think about, too. Yeah.
I mean,
And did she have to get them redone in 10 years?
yeah.
Because I'm a little young for
Good
that.
question. You got that point.
Yeah, all of those are good questions.
Good question. Good question.
I'm really just going to turn it over to you.
Okay.
Okay?
I can't hear it. Are we on? Are we on?
Are we on? Are we on?
Can you not hear yourself? Is that what you're saying?
No, I'm just wondering if are we on like some kind of
Live.
chat or whatever?
Not yet. Not yet. He's not started. yet.
Okay.
But he's-
Okay, the chat should be open
But
now.
he's fixing to.
So now we are.
Yeah, why?
Just wondering.
Yeah, I gotta call
She
her
wanted
next.
to pick her nose. Just
You want to
kidding.
pick your nose? I'll take you off. I mean,
I
No,
don't
we're
like
good now.
being
I'm
on.
just kidding.
there's no cameras on
No,
now.
we're good now. We're good
I don't
now.
like being on camera. This is a radio show.
We're good
I was
now.
coming and that's what she said. And my mom,
Wait, she said that? When did she say that? That's
No.
my favorite from that office.
Yeah.
When he went, that's what she said, and they're like, wait, she said that? You're admitting that she said that? It's so funny.
oh man, I love The Office.
And
Oh,
then
I
he's
know.
like,
Yeah.
and he's
See,
like,
that's what I do during
No.
the day.
That is the best show
They
ever.
took my Golden Girls off from until
Girls is
noon, which has really
classic.
made me mad. But now it's because it's all Christmas movies, which I like, but I'm not in the morning.
No. I'm just so over the happy shit.
I haven't started on them yet.
Lydia's starting to get a little more salty.
Bit bitter.
Bitter.
okay.
Thank you for calling Collins Studios host and call screener line. Please enter your show. Yo Blood, enter your 6-digit PIN number. Is you stupid? That is not a valid PIN for Weird
Oh.
Medicine. Please re-enter your 6-digit PIN or hang up if you are on the wrong show. Is you stupid? That is not a valid
Ugh.
PIN for Weird Medicine.
You're
Please
gonna get
re-enter
locked
your
out.
6-digit PIN or hang up if you are on the wrong show.
You're gonna get locked out.
I know.
Yeah, let's don't
No
do that.
pressure.
No, I said the right one. Wait. Ah, damn it. I see what's going on. Try it again.
Thank you for calling Collins Studios host and call screener line. Please enter your show. Yo Blood, enter your 6-digit PIN number.
Steve asked me if I wanted a
Welcome,
cricket
Funky
today.
Blood. You have not started a
That's
show
fine.
session in call-in studio and cannot
To
yet
put
receive
stuff
calls
in.
on Weird Medicine. Please visit the call-in studio website and begin your session. Crappy music will play in.
I could make
Welcome,
you all kinds
Dr. Steve. You is now in the
happy
host room
stuff.
and can manage your funky callers from the call-in studio web
Uh-oh.
interface. Laws you is a mess, dat for show.
That's the school system.
Your child missed one or more.
All right. Oh, where is it? Okay.
Look at us here, relatively on time.
I'm still doing research. But yes.
Yeah, I think we're good. Only 12 minutes behind.
That's typical.
Not
So
bad. Not bad. Not bad.
Okay, I'm calling her.
Okay. Bless you.
Pardon me. I think I got a sneeze.
you bringing us COVID?
Ebony.
Hey.
Hey, it's Dr. Steve. How are you?
Hi, Dr. Steve.
Sorry for the late notice here. We're just getting ready to get started, and so I have your bio, and that Lainey sent me, and then what we're gonna do is I've got my partner in the studio. His name is Lydia,
Hello.
and
Hi.
she never learned how to grow boobs, and so she's thinking about getting implants. And so we've had different people with different sort of size breasts on. And Lainey told me that you were enhanced. I don't know if you're natural or enhanced. It really works better if you're
I am. Yeah.
Okay. So basically she's got a bunch of questions to ask, and then of course we'll have you plug your stuff. And this will be on Sirius XM, and it'll also be on our podcast, okay?
Okay, great. So I'm just on set for browsers right now, so I got about maybe 20 minutes.
Yes.
Is that okay?
No, that's fine. But this will be real quick.
Okay, cool.
This will be quick. Okay.
Okay.
All right. Okay. Now, hold on. We're going to get you first. So we're going to start recording here in
Okay.
just a second. All right. Let me get the template. All right. You guys ready?
Yep.
Yes.
Okay. All right. And let me help if I had my script up. And Scott, you'll stay in charge of the. Scott, you'll stay in charge of the YouTube channel.
Always am.
Okay. All right. Good. All right, Ebony. Here we go.
Sirius XM. It's time for Weird Medicine with Dr. Steve.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out, blast it with the wave, an ultrasonic echographic and a pulse.
Oh, sorry.
Dating shave, I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
And we have PA Lydia. Hello, PA Lydia.
Hey, hey.
Oh, do we have a treat for you today?
I'm so excited.
Yes, this is a show for people who had never listened to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy I can't mention contractually. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. So anyone who's been listening for a while knows that PA Lydia forgot to grow boobs in school, and she did everything else, got straight A's and stuff, but that was one of the things she forgot to do. And she is considering, after having a kid and now kicking her, a guy to the curb, getting breast augmentation. And we've had different people on. We had Lady Diagnosis on, and we were going to have my other friend who had the Asia syndrome, but we talked about it instead. But today, as promised, we have Ebony Mystique, and you can follow her on Instagram at the official Ebony Mystique, and on Twitter at Ebony Mystique 1. She has her own podcast, Ebony Mystique TV. You can enjoy it on YouTube. And she started her career being a nurse. And then she is now an adult movie actress and celebrity fashion designer. And Ebony Mystique, thank you for being on the show today. Uh-oh. Is she there? Uh-oh.
I'm here. Thank you.
Oh, okay.
Can you
Sorry.
hear me?
Yes, now we can. I got very nervous for a second. Hello, and thanks so much for being on the show. Now, Ebony, you have, I'm looking at a picture of you, and it says here you're 36 triple D, which tells me that you must be smaller in stature than I would have expected, because you look much larger than that to me. But that's just me.
Yeah, these are 36 triple D. And I was smaller statue, but we had to fix that. I'm going to get a little bit.
Okay.
Well, I got a lot bigger.
Okay, very good. Okay, very good. You know what? We have a terrible connection. Can I? Hey, Ebony, I'm going to call you back. I know you've got limited amount of time, but we've got a horrible
Is
connection.
this good? Is this better?
That is better.
Yeah.
Actually, is better.
Yeah,
so
yeah.
I don't know what you did. So hang on just a second.
Okay, I just moved.
Okay, let me.
That's a lot better, yeah.
Okay. So let's start over with where I said you look much larger than 36 triple D, but that you must be short stature. Okay, ready, go.
Okay.
Yeah, so what's up with that? I guess I'm terrible at estimating this. I would have guessed you were a 42G just from looking at these pictures. So, you're very well enhanced, extremely well endowed.
Well, thank you. Originally, I didn't want to go so big, but the doctor thought if you're gonna come, you might as well get big or go home. So we decided to go ahead and
we're that. Our connection still stinks. I'll tell you what, Ebony, let me just call you back, okay? We'll try it one more time. And how am I talking to you? Is this your cell phone or is this a landline?
This is I can hear you perfectly. Sorry, there's a bad.
Yeah, it may be on our end. So let me just try calling you back and see if I get a better connection. Okay.
Okay, perfect.
Okay, I'm so sorry.
No, it's okay.
All right.
Thank you for calling Collins Studios
See,
host and
fine.
call screener line. Yo, blood.
Okay.
Welcome, Dr. Steve. You is now in the host room and can manage your
Okay.
funky callers from the call-in studio web interface. Laws you is a mess, dat for show.
I hope it works.
I do too. I want to talk to her.
I know, me
person
too.
you are trying to reach is currently unavailable.
Oh no. Okay, hang on. Yeah, she seems very delightful, and so I really want to make this work. But if we can't make it work, I will set this up. We did this at the last minute, and so this is my fault.
That's great. It's cool.
But the problem with the connection's on her side.
a guitar.
When are you coming back? 2 weeks?
I can go back next week, I think.
You can. Let's see how we're doing now. Hey, Ebony.
Hi.
We'll try it again, and I'll tell you.
Hold on.
And,
I got a good idea. Hold on 1 second.
Okay.
I'm going to go somewhere where I know it's going to work. 1 second.
Okay. Part of this, I mean, this is my fault because it's such late notice, and I apologize for that.
Don't even worry. It's okay.
Okay. Well, that sounds pretty good where you are now. I'm going to back this up to your intro.
Okay. How's this?
That actually sounds okay. Let's try it. If it doesn't work, what we'll do is we could set it up for maybe next week or the week after, and we'll get you on a Skype connection so that we can, I do the phone thing because it's more convenient for people, so you don't have to sit down in front of a computer with the camera and all that stuff.
Skype.
Okay.
Sure,
Well,
whatever you want.
okay, you sound great right now. Hang on just a second.
Okay.
Okay, you ready? Okay. So we're just going to start over. So.
Okay.
Okay, so I'm just going to start off with, and Ebony Mystique, thank you for being on the show because I've got all of the preamble already recorded. Okay, all right, and for goodness' sake, okay, thanks, and thanks for hanging in there. All right, let's see here.
You've reached the maximum length for voice messages. Goodbye.
What?
No.
Ebony, are you still there?
No, Ebony's still there. No, she's still there. Okay, you're still there. Okay. I don't know what that was about.
I'm here.
Okay. And Ebony Mystique, thanks for being on the show.
Thank you.
Thank you.
Thank you for having me.
Well,
I appreciate you guys today.
it is a true pleasure. One of the things, I'm looking at a photograph of you, and by the way, you are quite lovely and delightful. And Lainey Spicer, your publicist, sent me your measurements. It's your 36 triple D. Now, I must be just terrible at estimating this. I would have guessed you were much larger than that. So you must be small in stature. I'm surprised. I would have guessed like 42G or something, but I'm a guy. What do I know?
Close enough. It's funny, when I first decided to do the enhancement, I didn't want to go so big, but actually my plastic surgeon recommended that if you're here, you might as well go big or go home. So we went ahead and put 3 triple Ds in. Mm-hmm.
Yeah, sure. I've seen that on some of these plastic surgery shows, and I've seen it in real life. I mean, I actually am a practicing physician in real life and have had some experience with this, where women will get a one size and then decide that they want to go bigger, and they keep getting bigger and bigger, and that actually causes some problems. So you should probably go for the size that you want right off the bat.
That's good to know, because my third time was the charm. That's when I went this big. So, wow, I wish I knew you then, Dr.
Well, and you were a nurse before, right? I mean, that's what I read that in your bio. I actually did not know that before. So how long were you a practicing nurse?
Absolutely. Yeah, I was a critical care nurse for about 13 years, and then I decided my last year in the field to do advice nursing, and then here we are. Wow.
Yeah, I bet those guys saw you coming in the ICU, and they either got better or they just died. Had a heart attack. Well, listen.
Of course, these triple Ds wouldn't work in that field.
No, they would work just fine. But anyway, so PA Lydia, she's a physician assistant, and she. Did I say it at the beginning?
Yeah, I forgot to grow boobs.
Right. Yes. She loves it when I say that, or she never learned how. And so she's thinking about augmentation, and we had some folks on earlier. A lady diagnosis was on, and then we had another lady that was going to be on, and she actually didn't show up, but we talked about the complications that she had. And Lydia's got some questions for you. So I wanted to kind of go from small to medium to, perfect.
The eye of the beholder.
That's right. So anyway, take it away, PA.
Yeah. Hello, Miss Ebony.
Hello, how are you?
I'm great. It's so nice to speak with you. So I think the big question I have from being for 33 years now in the small boob club is some of the negatives that I should like think about and figure out whether they're worth it or not. So my first question to you is, do you have the back pain that people talk about, or do you just work out and prevent it? What's your take on that?
You went out. I'm sorry, I didn't get the question.
She was asking about back pain.
Yeah, do you have back pain from your large breasts?
Oh, back pain. Actually, they're really comfortable. And initially, just with the body trying to get used to a foreign object and it being so big, I think I did experience a little pain, but now I'm doing great.
Okay. Can I ask you if you still have your nipple sensation?
I do. I have a nipple sensation. I didn't lose that at all. And, the main thing is the support. Like when you go this big, you should like wear some type of supportive bra or something like that for sure.
Okay. And when they did it, did they go like under your pectoralis muscle, or did you go on top? How did that work out?
Yeah, they went right through the areola, and then they kind of closed it back up through there, and I was able to get a really good, nice shape afterwards. So
No kidding.
I'm really happy.
Okay.
I just followed the surgeon's guidelines.
That's cool. So they like made the incision around your areola and put it all in.
Yeah.
Neat. Okay. How long was your recovery? Like, how long were you like unable to lift stuff? Like, I have a 2-year-old.
I would say about 1 to 2 weeks was kind of hard. The first 2 days are the worst, and then it gets better after that. But after 2 weeks, you get, back to sort of, activity, just not too strenuous. They kind of recommend like 4 weeks. So it's best to kind of see how your body goes and just really take your time and do as the doctor says, the surgeon. Yeah.
Okay.
Now ask her the important stuff. What about unwanted attention from men? And do you walk around hiding your body when you're in public, or do you accentuate it and let people go? Hell, I paid for this. Take a look.
Stretch your stuff.
Yeah, do you stretch your stuff?
So I don't get much negative attention. I mean, I already do mainstream adult films, so but outside I'm more modest. I think the attention that I get either way is going to be somewhat sexual because of my job, but yeah, everything's been I've been pretty well respected out in the community with people. I kind of dress more modestly though out when I'm out and about.
Yeah.
Okay.
I don't really want the negative attention.
Yeah.
Yeah. I don't really like a lot of attention.
Me neither.
Yeah. But
yes,
but I
you
did
do.
have a boyfriend. Can I?
What?
I can say these things. I had
Yeah.
a boyfriend one time, and he was a. This is awful, but no one I know listens to this. Okay, so he was a virgin.
Okay.
Okay, and he was very well endowed, and he really wanted. He was like, I really want to try to do the between the boobs position,
Yeah.
right? And I'm like, I'm very sorry, but that is just not physiologically possible.
Right. Right.
Yeah.
So then he said, well, how about anal instead?
No.
Yeah, so he
Anyway.
wanted you to give him a boob job. Did he not know that?
I've never heard of a boob. Yeah, it would be a boob job.
Yeah. Mm-hmm.
And so, yeah, he wanted a boob job, and I couldn't supply that,
Yeah.
right? But Ebony, I assume that you can with that size.
Uh-oh. Did we lose her? Uh-oh. Ebony, are you gone? No.
Yeah, you guys and girls. Well, I will be back. Dr. Steve and Weird Medicine is going to have me back on Skype so you actually can see these triple D boobs
Yes.
and kind of get a face to this voice. I'll be back soon. I'm actually shooting for you guys today on my lovely fans and supporters for Browsers.
Okay, so
So yeah.
yeah, so go ahead and get your plugs out, Mystique, and Ebony, and then we will definitely have you back because we are having some real technical issues with your connection.
Let's do it.
I know they can see you on Brazzers. Where they go to brazzers.com.
Yes, go to browsers.com to see my mainstream scenes. I'm an exclusive contract girl with them. And then, of course, you can follow me on Instagram Ebony Mystique Official, or my Twitter is Ebony Mystique One, and you get all the goodies there. I can't wait to talk to all of you guys.
Okay. Hey,
Okay.
we'll
Thank you,
we'll do
Ebony.
this
Thank
again.
you.
I'm sorry about
Thank you
the
for
technical
being
stuff,
on.
but have a wonderful shoot, break a leg, or whatever you say when you're going to do a scene.
Okay, thank you. And I'll be waiting for you soon so we can set up the site.
Okay, I'll talk.
Okay.
I'll
Thank
talk to
you.
Lainey about it. Okay, take care. Okay, bye bye.
Bye.
Well, I hate that didn't
Yeah.
work out any better than
When
that.
I just divulged like the most.
I know, and then you got
and
nothing.
I got nothing,
You got
and I
crickets.
feel a little bit awkward about it still.
Well,
that
then
was something I had not shared with anyone.
Listen, I'm sure she can.
It was a long time ago. I'm sure she can.
Yes, of course. Can you do that?
Consideration.
Do you remember that time you gave that guy a boob job? That was
Listen,
awesome.
if it was a stupid question, I don't need y'all to tell me that.
No. It wasn't a stupid question.
No,
You
it's
just didn't want
stupid at all.
But yeah, so now you could call that guy, and after you have your enhancement,
Yeah.
and then give him a boob job if you want to,
Well,
or
there
not.
you go.
Or what would be even more fun is say, ha ha ha! Now I could do it, and I don't want
He was
to.
very nice.
Yeah.
He's a very nice Canadian fella.
All right.
Yeah.
I know you're all very uncomfortable with all of this, but we do have another person. I would like to have Ebony back on because
I
she
think that'd
seems
be
really cool.
Yeah.
Yeah.
And I was quite distracted looking at her promotional photograph.
I'm sure you were.
Because she's quite delightful.
He is the biggest boob man you've ever met in your whole life.
Bit
Well,
biased.
and it's not. I mean, look, I like the. And I haven't said this on the show in a long time because I've tried to be a little bit more whatever, but it's the tit to gut ratio. That's the thing, And we figured out one time, there's this thing called the golden mean. Have you ever heard of it?
No.
Okay, so it's a ratio. And the Greeks found that if you make buildings according to the golden ratio, which is 1.608 to 1, that they will have pleasing shape. And not only that, but the chambered nautilus has the area of the different chambers is in a ratio of 1.608 to 1. And you start seeing the golden mean everywhere. Sunflowers use the golden mean to make that sort of interesting pattern of the seeds and stuff. So you find the golden mean everywhere. So I said, well, it would be fun to see if the golden mean applied, to
Yeah. The
human
women-
proportions.
Yeah.
So if you have so what's your waist size? Just make something up. You don't it doesn't have to be real. Okay, let's say
Teeny.
Teeny.
but let's say it's 25 inches.
Shit,
Okay.
I doubt that.
So
Yes.
then if the golden mean applied, then the chest size should be in that ratio of 1.608 to 1, and the waist as well. So let's figure out what somebody would be if they had a waist of 25 inches. Echo, what's 1.608 times 25?
1.608 times 25 is 40.2.
There you go.
By the
40,
way, you have-
25, 40 is perfect.
40 on the waist. I mean, the hips. No thanks.
No, well, 40, 25, 30 something
Yeah.
would be perfect. So
36.
anyways, but
34.
so it's all about that ratio. You could be a tiny little person
Mm-hmm.
with 32 B's, but if you're a tiny, you've got a 21-inch waist, that it's perfect. So I'm not all about just giant boobs. If you weigh
Be
800
proportional.
pounds and you've got boobs hanging down your ankles, that's not going to be
The lady we just had
necessarily-
on, her frame is so small.
Yes.
Yeah.
And that's why her breasts look so.
Look, that's why they look so
Big,
big. Yeah,
yes.
yeah. I think if we saw her in real life, I didn't see how tall she is.
I mean, a triple D on me is
well, she's
nothing.
5'7". She's 5'7".
Okay, that's my height.
Yeah.
But
okay.
her
Well, there you
frame,
go.
though, I mean, she's got.
Well, her frame and your frame are exactly the same.
yeah,
So
that's
what
exactly
you would look
what
like.
you'd look like if you went that big.
Google image Ebony Mystique. There you go.
Yeah, I got
Yeah,
her.
that's what you would look like.
Yeah.
Yeah, I think that
I'd
looks
look
like about the
exactly-
right size.
He would.
Yep.
Sounds great. I might not go quite that big, but
we'll
we'll
be
talk.
filing
We'll talk
for
further.
divorce.
Nothing scared Steve Baumrucker more than
Then who?
than oh
115 30. Will you
Go ahead
will you
and
give me a
fix it.
note?
Can you
Oh, I
just
can
go
fix
ahead?
it now. Yeah, yeah.
Yeah, go
okay,
ahead and fix
yeah,
it.
you're right. Okay, hang on.
Oh, because we can't say his last name, and I.
Oh.
Okay, so when I do this, you're going to say nothing scared Steve more. Okay, you ready? 3, 2, 1.
Nothing scared Steve more than the consultation I had getting my breast reductions.
Yeah, that's not
Probably
a lie.
one of the worst days of his life.
Well, I wasn't. I thought you were perfect the way you were. But I did go in and I said, here's a picture of Katy Perry's tits. If you can do that.
That is an absolute lie.
What? What? No, I did. Yeah, I did. I brought
She's
in.
pretty large-breasted, isn't she?
Yeah, but they're smaller than what Tacey's were. I said, no, what are you talking about? I brought that in. I said, if you can do this, I'll be fine with it. I said that to the surgeon during that consultation.
I do not remember.
I'm glad he was concerned about your health and well-being.
No, I do not
that's
remember
so
a picture of
reassuring.
Katy Perry.
She was
anywhere.
comforting.
She was totally healthy.
I know.
I would
No, I
have
brought in a
Katy Perry
picture
boobs.
of Katy Perry and her boobs.
I
And
would
I
definitely
said, well, I'm not going to say it again. I mean, that's what I said to the guy. And he said, yeah, I can do that.
Cool.
He left.
do
He left a
not
little
remember
extra.
that.
Now, the other fucking thing about that whole thing was, I got behind it. I wanted to do what you wanted to do. But what pissed me off is they told us to be there at 5 in the morning. And so I get her there at 5. They take her back. And they say, well, we'll let you know when we're done. So I read my book for a little bit, and then I fell asleep. And then I woke up, read my book for a little bit, fell asleep. 9 in the morning, they come out. And I'm like, okay, cool. And they go, oh, we're taking her back now. They hadn't even started. They just had you back in surgical holding for 4 frigging hours.
Yeah, he was
That was annoying as
habitually
shit.
late. Yeah. I didn't know that when I scheduled him.
But what was cool was when you did have the arterial bleed in your boob New Year's
Holy
Eve,
crap.
and we're drunk AF, and she's got one breast is twice the size of the other one, and it's like rock hard like that.
That's crazy.
He came to the emergency room and took care of it. Now there's nothing more sexy than seeing your surgeon open up your wife's chest wall and scooping out
Clumps
large
of
clumps
blood.
of current jelly and then sewing it back up. That was awesome. But good
Wow.
God, what a night!
Yeah, that was a night.
And I'm talking about how bad it was for me. I mean, it's she.
Tasty's like, oh,
Yeah, it was
something.
slightly worse for Tacey, I
Yeah.
guess. But anyway,
But here we are.
yeah. But
Yeah.
yeah, now you're perfect.
Yeah.
Could use another one. We'll talk about that later.
Yeah. We'll talk about that when I'm serving you papers. So, so we'll have her back on. And then there is a fourth person that wants to talk to you that had some issues with what Lady Diagnosis said about her augmentation, and she wanted to just be the voice of reason for you.
Okay.
And then we'll have her on, and then you decide. And then whenever you do it, we can have the big unveiling here on the show.
Yeah.
I mean, hell, you've done...
Just unveil it. Just show it.
Actually, what...
We'll see.
I know it seems weird, but most women that I know that have had breast augmentation, they're like, yeah, you want to see them? It's crazy. And I'm like, well, sure.
Okay, if you force
The thought of that mortifies me slightly.
Nah, I'm good. No, you don't have to
saw
show us anything.
a friend of mine.
I'll show Tacey.
in a store after my last visit with my doctor, post-op, and I saw her and I said, let me go show them to you, and I did, because they were high and they were smaller and
High
they
and
were
dry.
perkier.
Yeah.
And she was like, they look great. Of course they didn't, because they were all red and bruised and purple.
And they got
Gotta
that
show them
anvil
to a
scar.
woman, like
Yeah.
every man I've ever showed them to is just disappointed.
Oh, I'm sure that's not true.
That could not be further from the
joking.
truth.
I'll tell you what.
That's not true.
Stacy
at all.
Deloach, who is has been on this show before, he doesn't like boobs, and so I mean he likes them, but he likes them really small. So he's like, oh no, I would tell her not to do anything. So there you go. So there are guys out there, obviously. Well, you had a baby.
That's where I
with
think you
one.
gotta toe the line, right?
Yeah, there's somebody for everybody.
There,
Yeah.
Even people that with
potentially.
A
Yes.
cups. even A cup. No, I'm just being an asshole.
I think I'm between A and B right now. At one time I was a B, but that was like 20 pounds ago. So
No, I had a girlfriend. Well, anyway, it doesn't. Nobody cares.
We
I had a
digress.
girlfriend
We
that had almost zero boobs, but I loved her, and it didn't matter. It doesn't matter.
It really
doesn't matter.
It really doesn't.
yeah.
If you care about
If you're sweet and you're smart and you're kind, it really doesn't matter.
yeah.
It really
Well,
So-
maybe I should get on those things then.
You got to work. You got to work on
Those
the
things are
sweet thing.
cheaper.
The sweet thing. Yeah.
They really are, and they're
The
less
smart,
pain,
the smart thing
Less
you've
painful.
less
But
physically
harder, though.
painful.
Harder to be nice and sweet.
It is. Yeah.
got. It is. Yeah.
Yeah, that's true. It's easier to just strut around with big giant tits, and everybody just agrees with you no matter what, just because they want to, be closer to you.
Yeah.
Closer.
Mhm.
Well, cool.
Anyway, all right.
Okay,
Well,
thank
good.
you.
Well, thank you. Well, yeah, you're
Thank
welcome.
you for that effort.
We put you in a in a position that you
great.
were not comfortable with, but what the hell?
Good stuff.
That's
All
what we
right.
do
I mean-
with our guests.
Yeah. A couple of things. You all were going to bring a grotesque story today, and PA Lydia is nodding. And then you had something from your friends at the rescue project. Did you want to talk about that?
Yeah, sure. So, my partner Harvey is really good at ideas, really cool ideas, and I'm good at like doing work, right? So we're great partners. He sent you or ordered you something as a token of appreciation for your support of Allied Extract and our
Okay.
humanitarian work. We were originally gonna.
Now, Allied Extract is where you were getting people out of Afghanistan.
Yeah, we formed initially to get people out of Afghanistan. So I think 417 people were taken out of Afghanistan on behalf of U.S. government and CIA requests, Johns Hopkins requests.
Through
and
you
then-
guys.
Yeah, through us, and then
And you had all these crazy cell phones that you were communicating with people and all this stuff.
And I'm
It was
still
gr-
getting
it was-
them out. Like
it
I'm
was
still
nuts.
chatting with Afghans every day. So I think now we're at like 2,500 people.
Wow.
So
Well done.
it's a lot. The U.S. government has relied on volunteers, but now they've taken over, so that's good.
Really?
and
They have?
They have taken over. They are tracking all of the eligible people who can evacuate Afghanistan, and they're managing it. And I have not submitted another person.
Really?
Yep.
Is that right?
And they're still getting out.
Okay.
Yeah.
All right.
So it's great.
Well, all right.
It's
Okay, good.
it's a win.
Okay, that is a win.
And so now we've been in Ukraine since the Russian invasion, helping people get out of like those frontline eastern areas.
Yeah.
We've got some orphanages we support. We send in medical aid and humanitarian aid. We send
Okay.
stoves to troops, whatever is needed, right? Just aid. Anyway, Dr. Steve was a great supporter of Allied Extract. So Harvey has ordered this,
What is this?
for you.
Ooh.
So you can read the top.
Okay. Made in Russia, recycled in Am I going to get on a list for this?
I don't think so.
Made in Russia, recycled in Ukraine. Never forgive, never forget. Wow, what is this thing? Oh, what the hell is this?
It's a piece of Russian tank that was blown up in Kyiv
Oh
during
my
the initial
God.
invasion of Russia.
Wow.
Oh my goodness.
And so if you scan the QR code, you can see the tank that this came from.
Are you shitting
That
me?
is crazy.
Oh, okay. Now I get it. Oh my goodness.
That's pretty cool, right?
Yeah, it's very unique. That's for sure. Wow.
Yeah. So
Wow.
that's just
Really
north
is
of
cool.
Kyiv during the initial invasion.
So do you
And
guys still need donations?
tank
We
was
might as
blown
well
up.
plug Harvey's
I
thing.
mean,
That's amazing. Tell him
yes.
Thank you.
Yeah, absolutely. AlliedExtract.org.
Okay.
We were trying to shut down and we just couldn't do it.
Yeah. There's still a need.
We're
Yeah, there'll always be a
there's
need
just a
to
need.
help
so,
refugees. so.
yeah.
Okay, well, good for you. AlliedExtract.org, and thank him very much for this. I
Absolutely,
really
yeah.
appreciate
That's
that.
super cool.
That is really
It's pretty
cool.
sweet. Yeah.
All right, good deal. Well, you guys want to take some medical questions?
Sure.
Let's do it.
Right, okay.
Number one thing, don't take advice from some asshole on the radio.
Okay, well, this one, I don't know what this is. It just said orgasms, and I figured it was apropos to what we were talking about today. So let's see what this is.
All right, this one might take a few minutes to get this question through, but kind of playing off of the female orgasm and squirting and things such as that.
Okay.
Listening to
This is your buddy who likes the A cups, by the way.
a podcast the other day called Mean Girls.
Okay.
Funny podcast. But anyway, one of the girls was talking about how she's learned that she can have an orgasm from her boyfriend manipulating and playing with her breasts.
Okay.
And then also thinking back that Stephen Hawkins, who's always been confined to a wheelchair most of his life, had a very healthy and
Sure.
fun sex life, according to his wife. So all that being said, the female orgasm, is that physical stimulation, or is that more of a mental stimulation? Thank you.
No, that's actually a really
Stay
God. That's actually a really, really good question. And I have several things to say about this, but you guys can chime in on this. You know, orgasms can be induced without genital stimulation, no question about that. I knew a guy that didn't have any feeling from the waist down, and he could have what he claimed was an orgasm by somebody stroking his arm repeatedly. And orgasms are spinal reflexes. They tend to be in the lower spine, but I guess, you know, the neurologic system is very plastic up to a certain point, and it can reprogram itself. Now, the story I was going to tell about orgasms was the brain dead guy that the wife wanted to have a baby with him before they took him off the ventilator because he was actually deceased. He had no brain activity, no blood flow going to the brain whatsoever. So she manipulated his genitalia, got an erection, and continued to manipulate until he ejaculated. She captured the sperm and or the semen and was going to use it to do a artificial insemination so that she could have a baby with him. Now, that just goes to show you even brain dead guys can get an erection and, you know, and complete the transaction. So I think a lot of women probably think most of us are brain dead anyway. But, you know,
It's the truth.
Well, that's because you're an idiot.
Okay. But that true story, that can be done because it is a spinal reflex. So what do you guys think about that? But long been known people experience orgasms during sleep with no stimulation whatsoever or after exercise. But the exercise, women who have it during exercise, we hypothesize that that's because they're jiggling.
Cycling.
Yeah, they're right. Yes, they're jiggling. They're either manipulating their genitalia, you know, with the bicycle seat, or if they do it when they're jogging, because there are women that are trying to jog and they just start having orgasms one after another. That their reproductive organs are just jumping up and down or whatever, you know, and stimulating those nerves. So, what do you guys think? Have you ever had an orgasm in a non-genital stimulation way?
I have.
Yeah.
Mm-hmm.
Yeah. Who said that? Tacey?
Tacey.
Tell, let's hear it. Oh no! Do you not want to?
It's when you listen
You just
to the
want to
doctor.
say
No,
that
it was a long, long
you just
time
want to say
ago.
that it happened,
And
You-
it did happen.
Okay,
Yes.
it just did happen. What could you want to say?
From what?
Just kissing.
Really?
Really?
Mm-hmm.
Did
Oh,
it
wow.
feel the same?
Yeah.
Oh my gosh.
Yeah, here's I'm looking at a case report. 33-year-old woman developed the ability to attain and control the duration of subjective orgasmic state without genital stimulation after, Scott, you'll be interested in this, tantric training. Blood was taken at weekly intervals before, during, and after spontaneously induced orgasms that lasted 5 to 10 minutes. Or after 10-minute period of book reading. Okay. Plasma was analyzed looking for luteinizing hormone, follicle stimulating hormone. These are pituitary hormones, free testosterone, and prolactin, which is also pituitary hormone. The woman also provided subjective scores. So here's the results. Prolactin levels post-orgasm increased by 25% and 48% respectively after the 5 or 10 minute non-genitally stimulated orgasms, or NGSOs, and were still elevated from baseline 30 minutes after orgasm. No changes were observed in FSH or free testosterone. And after, let me see, the pattern of all of these things were similar to orgasms induced by clitoral or anal stimulation. Book reading did not result in any change in prolactin. So she wasn't bullshitting because you
Yeah.
could just, you know,
That was the control.
do like Harry, exactly right. You could do when Harry met Sally and just pretend to have an orgasm, and how would anybody know? But you can't fake the changes in your pituitary hormones that are released during orgasm. So that's pretty cool. I would have also had them check oxytocin levels.
Mm-hmm.
You know, but anyway, I think that's fascinating.
I'm not sure I would want a 10-minute orgasm.
I mean,
Well,
you
Tacey
know,
can tell you about
people
10-minute
have stuff to
orgasms.
do.
She has those all the time, right?
Oh yeah.
Probably be good exercise.
I wonder how many calories are burned per orgasm.
Not very many. That's an interesting thing, that intercourse is very calorie efficient, and there's a reason for that. When you are a starving hominid that's trying to run away, you know, one of our ancestors, running away from saber-toothed tigers, and you hardly have any food because you're a forager, maybe you haven't learned to hunt yet as a species, and you need to, and you're trying to have, you know, reproduce in between all these sessions of running away from saber-toothed tigers. You don't want to waste a lot of calories. So it becomes very efficient, even though it seems like, oh, we're sweating and we're doing all this stuff and we're out of breath and all those things after having a prolonged session of sexual congress. It actually doesn't use very many calories at all. Isn't that interesting?
That's pretty wild.
Here you go. Types of orgasms and how to have them. Let's see. What do you mean by types of orgasms? According to longtime sex educator Sierra Dasak, owner of Early to Bed, a pleasure product company in Chicago. So she's not biased.
Not at all.
Because the anatomical structures that can lead to orgasm are often intertwined and hard to distinguish, someone might have an orgasm from stimulating the front wall of the vagina, a.k.a. the G-spot. Well, now she's just making up stuff. Or have an orgasm from stimulating the external portion of their clitoris. But ultimately, these orgasms all come from the same place. Well, there's no science here.
Lady, come on.
She's just selling toys and
Yeah.
saying things. But anyway, all right.
Okay. Well, that's impressive. Kissing. Some kiss.
Yeah.
Well, yeah, it's a long time ago.
Yeah.
Yep.
I've never had that.
Twerk with me, I'll tell you that. Nope. Nope. My best sessions with Tacey were with her alter ego named Tacinda.
Tacinda comes out after about 7 glasses of wine.
Yes, and Tacey and I, you know, I'm getting it on with Tacinda, and you know, all over the place, you know, on the couch and then on the floor and then on top of the couch and then all this stuff.
Don't remember it.
And then the next day, and I'm like, damn, I did pretty damn good. The next day, she's got no recollection of it whatsoever.
Why are my panties on the floor?
Yeah, I mean, that's
Oh
exactly what.
my
That's how I knew.
gosh.
That's how I knew. She wakes up and she goes, "Why are my panties on the floor?" And I'm like, "God damn it!"
I was so
I was,
good.
Oh yeah, but all I can do is just tell her, you know, oh yeah, I was awesome. Okay, sure. Why wouldn't you say that?
Yeah. Tacinda.
Tacinda.
It's like Tawanda from Fried Green Tomatoes, only the sexualized version.
Yeah. Well, Tacey
my
has a
alter
friend
ego.
who's been
That's
on the show before, and when she
drunk
drinks,
Tacey.
when she drinks, her alter ego is, well, her name is Wendy, and her alter ego is foreign language Wendy, because she is, you can't understand the things she says. So
That's
she's fun. She's fun. Okay. Let me see. This one says how to pay for stuff, and then we're going to get to your gross questions. Let's see.
Hey, Dr. Steve. This is Brad. I'm the guy who fell 23 feet. Called a few months back. Drove myself to the hospital.
Huh?
I was just wondering
Fell
about
23
pain.
feet.
Oh,
I always think about pain a lot, especially since I'm sober. Never gotten the painkillers, but just drinking. But I was wondering, I know you probably answered this before on one of your podcasts, but if people feel pain differently.
Yeah.
Like,
True.
I feel like I have an extremely high tolerance for pain, but I also feel like as a blue-collar guy, I've lived most of my life with it, and it just becomes normal. And
Yes. Now, this is a real good point.
Very true. Yeah.
I mean, I live with pain every day. It doesn't affect my quality of life every once in a while maybe, but really not to any great extent. I still do all the things I'd like to do. And yeah, you know what? Because my back is so effed up, I don't have to jog anymore.
Exactly.
So it's actually a plus in that regard. But I know people, and the thing is, if I could feel their pain, then it would be my pain, right? It wouldn't be their pain anymore. So this is a philosophical question that has been bandied about by philosophers for ages about pain. But I have seen people whose backs aren't as effed up as mine who are completely disabled.
Yes.
Now, is it because their syndrome is different, or do they just have a different tolerance for pain than I do? So that's kind of what he's getting at. So let's see where he goes with this.
Just need higher and higher amounts of pain before you start feeling something.
Yeah.
This could go for emotional abuse also.
Yes, I agree. I agree.
Yeah, I was just wondering if you just get more and more accustomed to pain.
Well, Scott can talk about this.
Oh, yeah.
Yeah. We could talk a little bit about depleting substance P and stuff like that, and we'll get to that. But go ahead, Scott. You're the pain expert.
I don't even know where to start with this question. So I would say yes.
Well,
certainly, the more pain you've had in your life, typically the better you tolerate pain. And when we start looking at people backs like your backs, as you said, sometimes we'll look at images of a lower back. It just looks awful.
Yeah.
I mean, just a train wreck.
Right.
And you look at this person, you say, how in the world are you even walking? Much less kind of
Yes.
being normal, normal bladder function, normal bowel functions, etc. And then we'll see, someone who you look at an image and it's like,
there's nothing
God,
there.
there's nothing there, and they're just miserable. And there's so many factors. History is one. You've seen the reports where redheaded people tend to have less pain tolerance. Have you
Oh,
seen?
really?
Yeah,
I have seen that.
Oh, I thought it was more.
No, less. Much lower levels of pain. And then the other thing, Dr. Steve, is our long-term use of opiates.
Yeah.
And sometimes when people have, and one of the things I hate to see in my office is someone who's been on heavy doses of opiates for years. They tend to develop this thing called hyperalgesia.
Yes.
So they have a much greater reaction to pain than what we would think would be normal.
So hyperalgesia is an increased sensitivity to feeling pain.
Yeah.
And then you have an extreme response to pain.
Yep.
And that can actually be caused by pain medication.
Yes,
too.
it-
There
yeah,
is a thing
absolutely,
called opioid-induced
Hyperalgesia,
hyperalgesia, where the more stuff that you put people on, the worse that their response to pain is. And I'm going to give Dr. Scott a bell.
Give yourself a bill.
Research has shown that people with red hair perceive pain differently than others. They may be more sensitive to certain types of pain and require higher doses of some pain-killing medications. Now, however, I'm going to give PA Lydia a bell, too.
Give yourself a bill.
Studies suggest that their general pain tolerance may be higher, so you were both right.
Ha!
So there you go.
High five.
Way to go, sis.
As a ginger.
Yes, as a
Yeah.
I do know
So
this.
do you notice that?
Oh, absolutely.
So tell
My friend and I talk about like what is pain, like what is even pain
Yeah.
that people get. Yeah, I like cracked some ribs one time, and it was quite painful. But like the question is like, when do you take pain medicine?
Right.
Right. So I
Yep,
could
right.
tolerate it. On the flip side, I was having an emergency C-section, and they kept giving me anesthesia, like to block it. And I just kept telling them I could feel everything.
Wow.
So they ended up having to intubate me.
Really?
Because they could
put
not
you under
get
general.
it. Yeah, they put me under general because they could not. They like cut through, and I'm like, I can feel it. Then they go into the
man.
muscle. I'm like, then I start screaming, and I will
Oh,
give.
you were screaming?
I will give the ex a bill because I remember him saying she's really quite stoic. Like she's not a screamer. She's really quite stoic.
Yeah.
So then they
In
put
other
me
words, if
under
she's-
general. Yeah, I could
Yeah,
feel it.
really hurt
Yeah,
you.
so definitely we require more in it, like if you're going to do suture or something like that, more lidocaine
Right.
or
Interesting.
Yeah, that's kind of
and I've seen that in practice for sure.
Yeah. Yeah, I know. If you have pain, it's such a complicated thing. And, I'm like you, Dr. Steve. I tell people, whatever you do, just don't compare your pain to anybody else's.
Right.
It's yours.
Exactly.
And
That's
if
important, yeah.
if you say it hurts, then it does hurt.
Yeah.
And let's try to figure out what we can do to make it not so awful.
Yeah. And pain really is just the body's system of alerting the brain that there's something wrong.
Right.
And part of the problem is that there is neuropathic pain too, where it's pain of damaged nerves, and PA Lydia induces this in people every day with chemotherapy and stuff. And diabetics have it as well. And that's a non-functional pain because that pain is just telling the body that the nerves are damaged. It's not really
Yes, don't say move your hand away from the fire.
That's right. Because nociceptive pain is a normal pain that keeps you from putting your hand, when you're little, putting your hand on the stove twice.
Exactly.
You might do it once, but you won't do it twice. That's nociceptive pain.
Right.
And then, of course, there's visceral pain. That's just pain from
organ
stuff, and which really, before we developed surgery, what was the purpose of that other than to tell you you're going to die?
Exactly, yeah.
You know?
Bye-bye.
Yeah. It's kind of sucks.
Yeah,
but anyway.
isn't that the truth? It's like you think back in time, you think, God, living with, like an acute appendicitis, how long were you going to live?
Well, some people did probably live.
And they probably did, yeah.
But there was... That's one of the advances in modern medicine that's really made a difference. The biggest leap in lifespan was sanitation,
right?
And separating our stool from our drinking water. And when we did that, then we went from living 35 years to, whatever. And then it's been incremental since then. And a lot of the stuff we do in modern medicine is lifestyle stuff. So when you get an appendicitis, you can go in and take your appendix out and you don't die a horrible, painful death anymore.
It may add real quick to this pain story because I love talking about pain. But years ago, we went to see the in New York City in Manhattan, in the museum there, they had a photo tribute to the Civil War. So all these pictures in the Civil War, and they had all these soldiers standing there, and one would be standing there on a crutch and his legs been cut off, and then they've got another one, biting on a belt, and they're sawing his leg off, and they see pictures of this.
Yeah,
it's like, God.
I have people come in. I say, "What's your pain today?" And they'll say, "Oh, it's a 10." And I say, "Okay, let's recalibrate this a little bit."
You seem rather calm.
Yeah, right. Yeah, a 10 is you're in the Civil War. You got hit by,
exactly.
You got hit by a musket, and I am now sawing your leg off without anesthesia with a rusty saw. That's a 10.
And they're pouring alcohol in it to
clean
it.
And then
stabilize it. Yeah.
You
and
have
then
all the
cauterize
pain.
it.
And then cauterize it.
Right.
Oh my God.
That's a 10.
Yeah,
so on a scale of 1 to 10, with that being a 10, what are you? Well, about a 4.
Yeah, exactly.
So it just, you got to get the scale calibrated. That's all.
Yeah.
Do you calibrate the scale? I don't bother calibrating the scale with people.
I do for that kind of thing. When I've got somebody who walks in and sits down and says, my pain's a 10. And I want us to be on the same page. So that if I write a 10 down and someone comes in later and goes, well, this person's a 10, and they didn't, they gave them Lortab 5s or something, that seems pretty heartless. But if you recalibrate it, with that being a 10 so that we all agree that's a 10, then it just makes it a little bit easier for us to compare what we're doing with each other.
Because that's wise.
The notes in the chart are really for the next person to read, but or the attorney, unfortunately. Let's talk a little bit about extinction of pain, though. Substance P. You want to talk about it a little bit? You deal with substance P, right?
Yes.
Or am I putting you on the spot?
Well, a little bit on the spot, but so with the acupuncture, we work on both the peripheral and the central nervous system as far as pain control.
Yeah.
So you've got peripheral nerves that are stimulated, and typically, if you're going to take an oral medication, an Advil, Tylenol, aspirins, those things help with the peripheral nervous system and affecting the substance P and how that's transmitted, right? But the electric acupuncture actually stimulates the endogenous opioids in the brain, the mu opioid stimulating hormones.
Right. So they're like opioids, right? You said that.
Yeah. So, one of the things I love about what I do is speaking specifically for, nerve pain, radiculopathies, we call them. Let's say somebody's got a really bad shingles pain.
Yeah.
Okay. So, which is a really good example, or a discogenic pain. So a disc is maybe pinched.
Yeah.
What we actually can do is by putting the acupuncture needles and the electrical stimulation to that, we actually stimulate more of this substance, and flood the spinal cord so that all of this pain is dampened greatly, if not sometimes
just
turned off.
Yeah, re-regulates.
Yeah.
So substance P is this neurotransmitter that's thought to transmit pain signals.
Right.
You can deplete substance P, like in people who have shingles and they have what's called post-herpetic neuralgia, where you've got pain that persists even after the shingles are gone. And it's just because those peripheral nerves are being stimulated. You can put capsaicin cream on there. That's cream that actually has the stuff that makes red peppers hot. And when you rub it on the skin the first couple of times, it'll burn, obviously, because it's like rubbing jalapenos on your skin. And then if you keep doing it, it will deplete that substance, substance P, this neurotransmitter, because you've used it all up. And now you can't transmit pain signals anymore, and then it makes the pain go away. So you have to keep that stuff on there. The interesting thing is that substance P, which is this neurotransmitter, also is involved in inflammation, but also in mood and anxiety and learning. So if you've got someone that has horrible pain, this may affect their mood and their anxiety level, and so you get this whole syndrome that we call chronic pain syndrome.
Blood pressure.
Yeah. So anyway, it's just kind of interesting. So people who say, that person's anxious and they've got chronic pain, and there may be a reason for that. They're being flooded with this substance P stuff. So it's just one hypothesis, but very interesting. You got any questions? Oh, wait. Well, let's do our gross stories because we're actually running out of time. So who wants to go first on this? We're not actually competing today. So
I've got a couple questions. I did not bring a story.
Okay. There you go. Okay.
I can go. You want to do the questions?
Tacey, did you bring your gross
I
story?
have an interesting psychological disorder.
Okay. Ooh, I like it.
Well...
Yeah, go ahead.
Go ahead, yeah.
Oh, you were just talking about yourself. Yes, it's
That's what she said.
That too. It's called the Jerusalem syndrome.
I've heard of this.
And it occurs when a visit to the Holy Land triggers obsessive ideas about religion.
Really?
And even messianic delusions. The condition can affect anyone, regardless of religion. Symptoms may include compulsive cleaning and grooming, wearing white robes, and sermonizing.
Holy moly.
Sufferers without a pre-existing psychiatric condition typically return to normal within 5 to 7 business days. Or it doesn't say business days, sorry. That's the old worker in me.
I love it.
And they feel some shame about their behavior.
Wow. I've got a psychiatric journal. Acute psychotic state observed in tourists and pilgrims who visit Jerusalem.
Isn't that crazy?
What if you live there? The main symptom of this disorder is identification with a character from the Bible exhibiting behaviors which seem to be typical for this character. Well, you don't want to be one of Job's daughters, because then you'd be having sex with your dad when you get back.
Oh, for God's sake!
Oh, for God's sake!
Well, I'm just saying they're they're characters in the Bible. The article presents an overview. Okay, 3 main categories of the syndrome were identified with special focus on the category unconjoined to previous psychopathology, the pure form of the Jerusalem syndrome. And oh wow, okay, and so they just give the diagnosis.
I like
criteria,
how they're
but that's
embarrassed
something.
after.
Yeah,
that
there's shame afterwards. So wow,
becomes psychotic after arriving in Jerusalem.
I bet they see this all the time. And people get off the plane and they get in their hotel room, and then they start acting crazy, and the people in the hotel are like, "Well, we got another one, another Jerusalem syndrome." Isn't that something? All right, very good. Okay, well, we can't just go wow and just sit here and read.
Yeah.
We have to actually put on a show. So
I'm just imagining. So to be fair, you didn't say grotesque in the prompt. You said bring a fucked
That's
up.
exactly right.
Oh, I said
you said bring
story.
a fucked up
okay,
story,
that's
right?
You're right.
So that changed me a little bit.
Okay,
So
yeah.
I got a couple.
Okay.
They're quickies.
Yeah, that's fine.
I didn't delve into a lot. So number 1 repeats the theme. So there was a 2006 case. Essentially, what I did was look at the worst malpractice cases in history for this. So there was a 2006 case where the anesthesiologist administered during surgery the paralytic, but forgot to give the patient the true anesthetics and the medications that help induce amnesia so that you don't remember the
Oh, no.
procedure. So the patient
they paralyzed
they
him?
paralyzed the patient
they
and
were awake.
operated on him. They were awake. So about 20 minutes into the surgery, they realized this guy's awake.
What?
It's awful. So he was feeling all of the pain, but he couldn't move. He couldn't shout.
Right. Yeah.
He
So
couldn't. And I've heard of this happening.
there are
the
these
worst
medications.
nightmare for
Yeah.
people.
They're just called
That's
paralytics,
fucked
and
up.
what they do is they just shut off your ability to move. And when you do that, you can't give somebody one of those unless they have ventilatory support because they will die. They can't breathe, they can't move, they can't do anything, but they are absolutely awake unless you don't ventilate them, and then they'll faint and then eventually stop breathing and die. So that is a nightmare.
Don't they
Kinda
do
messed
that
up.
when they do the gas or the death row for the inmates?
No,
Thing?
I don't know.
They use that.
They use
that
potassium, I think. They
paralytic
give them,
first.
They give them propofol, and then they give them potassium. Maybe they do paralyze
There's a
them, too.
couple
I
of
don't know.
different things that go in there.
Yeah, I was gonna say it's a,
I mean,
it's a nice
according
cocktail.
to,
So this particular case, the patient committed suicide a couple weeks after.
Yeah, I'm sure it was
Oh.
so traumatic.
Yeah, extremely traumatic.
Because
So
you just think your
yeah.
life is one way, and then all of a sudden you're just being,
operated on.
holy moly, that's awful.
That's some Civil War shit.
Yeah, well, I wonder if that had to be traumatic for them too. I mean, having
Yeah.
your leg sawed off just while other people are just crowding around watching it. Goodness gracious. All right. Well, listen, thanks, PA Lydia. Check out Dr. Scott's website at simplyherbals.net.
Yep.
Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Goodbye.
Bye bye.
All right. Let's do more of your stories for the second for the podcast part.
Well, I was gonna say let's or hold
And then we
the
have
story-
stories from there too.
Yeah, I was gonna say, yeah, hold the stories because we got a couple of good questions.
Okay.
down
All
here.
right. Let's. What are the questions
Well,
before I do it?
the
Just
first,
give me
the first one is going to be Bob Dandy wants to know the difference between DOs and MDs, especially when he's talking about for his back pain.
Okay. Yeah.
Number one.
Okay, we can do that one.
Number two. Chalazion question since
Oh,
you've had one.
Chalazion. Yeah. We can talk about
Chalazion.
that.
Chalazion.
Yeah.
Question.
Okay.
Somebody's dog has an.
Okay. Let's do it.
And yeah, so we've got a couple good ones.
Okay. All right.
Sorry, Lydia.
No, you're good.
That's good.
Just save them.
Oh, I'll say
Yeah,
that
same
shit,
to next
yeah.
week. Yeah.
Okay. You ready?
Mhm.
Okay. I mean, that would just have to be disastrous. Anyway, you have some questions from the waiting room,
Yeah,
right,
nope.
Dr. Scott? Let's do those, and then Lydia, save yours. You're going to come back next week?
I could, yeah.
Yeah?
I think
Can
I
you just
can.
come back every week?
Not every week. So here's the thing: like, I don't have a babysitter, right?
Okay.
So every other week, like,
How old's your kid?
she's 2.
She's old enough.
Benadryl.
I know. I've just never had a
vodka.
babysitter. So it's like
Should be
my
fine.
mother, who's a bit passive aggressive and doesn't like to babysit unless I'm working.
Bring her here.
In clinic.
Bring her here, and Tacey will watch her one time, or Beck will, or something. Yeah.
No, I really should get she needs to have other
Yes.
like outside people. I've just sheltered her quite a bit.
Okay, well, we
So,
can
yeah.
talk about that because
We'll figure it out.
We might be able to help you in that
Okay.
regard. All right.
Okay, yeah.
Okay, so
Next
either
week.
next week or the week after.
Yeah, next week is good.
All right. So what have we got, Dr. Scott?
Yeah, so Bob Dandy was asking about the difference between a DO and an MD, and he's got some chronic lower back pain.
Okay.
And was wondering our thoughts.
Yeah. Okay. DOs and MDs. So DO is Doctor of Osteopathic Medicine, and then MD is Medical Doctor. And then you have MBBS. Those are people who come from certain other countries, and that's just what they're thinking. I can't remember. It's Master of Biology. I can't remember what MBBS stands for, but it's the same thing as MD. Let's look it up real quick. MBBS. It is Bachelor of Medicine, Bachelor of Surgery. Okay. And it's the same.
Okay.
And when they come here, once they get licensed, they'll just get to call them MD. they'll change it to MD because nobody knows what the hell an MBBS is in this country. So now the curriculum is exactly the same. There are some parts of the country where mostly what they have is DOs. When I was a kid in Michigan, my pediatrician, the family general internist, the person who delivered me, they were all DOs. And then in other parts of the country, like the South, here, there was a while before they accepted doctors of osteopathic medicine. And that was unfortunate. It was just some, I don't, know how things are.
There weren't a lot of schools here for it.
Right.
Now there are.
Yeah. And when people we had an OBGYN come, and he was a DO. He was the first DO OBGYN that got privileges here. I was here when that happened in 1980-something. Everybody loved him. And once they realized, well, okay, they're just the same, then and it actually opens up your pool of people you can hire if you will also hire DOs and MDs. Now, these days, I'd be interested in talking to any DOs that have had any discriminatory practices against them when it comes to getting hospital privileges, but I'm not aware of any anymore. So, but the thing about the DOs is they have another part of their curriculum that MDs don't have, and that is osteopathic manipulation.
Right.
So they do, muscle energy stuff, and they do manipulation. It's not like it's different than chiropractic medicine. As a matter of fact, the person who invented osteopathic medicine,
A.T. Still.
Well, there you go.
Andrew Taylor Still.
Ain't you something?
Give yourself a bill.
He had this method where he would put people's, like if you had a hip pain, he would get you on the table and he would manipulate you around until he found a position where the pain went away. And then he'd just hold you there. Because he was teaching the body that you can not have pain. And so that was one of the methods that they used. And go ahead.
I was going to say, you do remember that we had his great-granddaughter was a patient of ours years ago.
Really?
Well, way to just break the shit out of some HIPAA there, Scott. But anyway.
Oh, I did say a name.
Oh, okay.
It's a bit identifiable, but
Well, he had more than one.
It's probably expired.
Okay,
Let's rewind.
Let's just let's go back.
Look, you messed up. I messed up. It's okay.
I just don't want you to get in trouble. So
I didn't say we did anything to her.
Yeah, I know. No, I know. He said we had her as a patient, though. Did I have her as a patient too?
Yes.
Okay. Well, I don't remember that. But anyway, okay.
You're trying to incriminate him.
Hang on. Let me figure out how to get out of this. And we had some sort of connection in that regard, going way back, Dr. Scott. But anyway, it's a really fascinating thing. I have absolutely no issue if you go to a doctor of osteopathic medicine and do some of the things that they do. Now, I will tell you, a lot of osteopaths, when they get out of osteopathic school, they don't
do it anymore.
They don't do it anymore.
I was married to one. No. So we were married during all of DO school.
Oh, is that right?
Yeah. And
I didn't realize he
would have a lot of females in his apartment practicing OMM.
Yeah. Ooh, let's do the.
I was married to one too.
Well, and so one of the
vigorous chest massage.
Yeah, actually though, so I was able to learn quite a bit from him, and it does work, like muscle energy techniques, things like that. I mean, it's quite different from chiropractic.
Yes, very very different.
But certainly, like you said, Dr. Steve, like the curriculum is the same. The boards are essentially the same. Yep. He took like the main internal medicine boards.
I'm getting ready to start a fellowship at a DO through a DO medical school or osteopathic school, and they actually want an MD to be the program director so that they can get MDs and DOs in the program. So they're all together. The programs here have DOs and MD, graduates. It's totally fine. Well, but if you can find one that'll do manipulation, if they like doing it, that's the ones.
That's exactly. And thank you for saying it, because
we have a friend who actually.
Yeah, I was gonna add to that. So for old Bob Dandy there, the MDs and DOs, as long as they know what they're doing, they're going to be great.
Right.
The one benefit, and many MDs, like Dr. Steve, can actually do some of those really gentle manipulations.
Yeah, because I trained with DOs.
Yeah. So just make sure either way you go, just find somebody that knows what the hell they're doing.
And they like to do it.
And they like to do it right.
That OB He, a lot of women have low back pain when they're pregnant, and it's not only because of the weight, but because there's a hormone called relaxin that's changing the way that the muscles and the
ripping
ligaments
their
are.
backside apart.
Yeah, right. Yeah, it does that. And he could do manipulation on their back that the MDs didn't know how to do. The MDs just give them medicine or tell them deal with it. And he could get them up on there and flip them around and put his fist under their back and then twist them a certain way and get their pain better. So, there were things that he could do that other people couldn't do. So, it just really depends on the provider, but they do have that in their curriculum that's beyond what MDs get. So it's pretty cool.
Yeah.
Yeah.
And I've got one other quick question for you, Dr. Stephen. You're the expert on this. So we've got, and I was trying to see who, Doug. Doug, unfortunately, has a pup that's got a big Chalazion.
Oh, my God.
So, unfortunately, yeah, he was just asking your thoughts about that.
Yeah, okay. Well, it's just a bump on your eyelid, basically. These things can also be called meibomian cysts, and I've had them. And as a matter of fact, if you go to our YouTube channel, the one viral video that I've got is Dr. Steve gets a Chalazion removed. It had like 300,000 views. And then YouTube told me, well, you can't monetize this because it's a surgical procedure. But anyway, you can go look at it. And very often these oil glands become blocked in the eyelid, and it'll cause a sty. And then when the sty resolves, it will leave behind this little mass of fibrous tissue called a Chalazion. And the way that they remove it is crazy. It sounds totally nuts, but you don't want to take it out from the eyelid side, the skin side, because if you do, you'll end up with a scar there.
Right.
So what they do is they flip your eyelid, they invert it, and then they'll stick a needle in it where the Chalazion is and fill it up with numbing medicine.
Fluid.
And then, yes, well, it already has, it kind of has this, it's not even fluid, it's kind of just a fibrous
like a granulated
mass. Yeah, kind of, yeah. But yes, they'll inject fluid, pain medicine in there to numb it up. And then they will cut a slit in the eyelid, but you want to do it from the top of the eyelid to the lash part. You don't want to go sideways because that'll really screw it up. But the fibrous structure of that is in that direction. So you just cut along the grain and you open it up and just take a curette and scoop that sucker out of there. And you don't do anything else. You put some antibiotic ointment on there and just go about your business. And when it wears off, it hurts a little bit. It's not that bad.
Oh, good.
And the thing with me was when I used to get these Chalazions all the time, they would be so big that they would distort my vision because they would change the shape of my eyeball in a very subtle way, but it was enough to mess my vision up. So I would want to get, and they look stupid too. You got a big lumpy eyelid.
So surely they can help that puppy.
Yes, absolutely. Now, a puppy isn't going to let you just sit there and stick a needle in their eyelid. So they'll have to put them to sleep. Yeah, they'll have to put them to sleep. Or I'm sorry, not put them to sleep.
Oh,
that has a different connotation with dogs. They'll have to give them general anesthesia.
Yeah.
Now, I'm going to tell you, I had the most enraging story that has to do with having a Chalazion removed, not with that doctor, but his partner. And I rotated with this guy. He knew me, and I've known him for years. I went to him. I had a Chalazion, needed to get it removed. And it turned out that this guy just liked doing cataracts, so he didn't like doing all this kind of bullshit, right, in the office. So, but he comes in and he says, okay, let's do it. And, when someone flips your eyelid and sticks a needle in your eyelid, you're going to grip the,
yeah,
you're
going to have something.
You're going to white knuckle it a little bit, right?
Yeah.
Well, I had a book I had ghost-written an archery book with a friend of mine.
Cool.
And he was 10-time indoor national champion. I ghost wrote this book, published it, but I had the brand new books, and so I was flipping through it to proofread it to make sure they were okay before we sold it. So I had it in my lap, right? And he sticks this thing in my eye, and now he starts talking to me like I am 5 years old, maybe not even 5, maybe 3.5. And he's like, oh, are you the big archer? Yes, you are. Oh, you're the big Archer, aren't you? And I'm
That
like,
is so
will you
creepy.
shut the fuck up? Dude, that was so weird.
What
And
the hell?
I guess he saw me sort of white knuckling, but it's like, dude, just do it and shut up and don't talk to me.
Are you the big?
Are you
Is that
the-
what you say in the bedroom?
Are you
That's
the
what I
big
said.
Archer?
I'm going to start.
That's what she says when we're strutting our stuff. Yeah.
Big Archer.
Are you the big Archer? Yes. Give it to me, big Archer.
That ended really quick.
Yeah. Yeah. Oh, your arrow is so big.
Good stuff.
All right. Got anything else?
I'd say let's wrap it up.
Ugh.
Wrap it up.
Right. Well, thanks always go to Dr. Scott. Thanks, Tacey. Thank you,
you.
PA Lydia. Always a
thank you,
delight.
guys.
Thanks to everyone at Sirius. Thank you for allowing us to go on your breast journey.
Yeah.
Yes. With
Odyssey.
With your Odyssey. Right. Breast Odyssey. Ooh, I like it. There's another word that's coming into my head, and I'll think of it before next time. Thanks to everyone at SiriusXM who's steadfast support of the show. You know, I've been doing this 17 years. We start talking about boobs, I still get all tongue-tied and weird. Lewis Johnson, Jim McClure. I'll just shut up now. Sam Roberts, Jim Norton, Travis Tepp, Troy Hinson, Paul Charsky, and Roland Campos. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for podcasts, schedules, and other crap, and listen to our podcast at riotcast.com or wherever podcasts are found. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Goodbye, everyone.
Bye.
Hey, guys.
All right, let's do the opening and then we'll be done. Good Lord. Okay. All right, you ready?
Mm-hmm.
Here we go.
How do you get a barber to cross the road? Just yell, "Comb over here." What did the Kaiser roll say to the bratwurst? Gluten Tag.
It's backwards day today.
A grasshopper hops into a bar. The bartender says, "I'm going to serve you a drink named after you." The grasshopper responds, "You have a drink named Steve?"
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, traditional Chinese medicine provider. It gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
And PA Lydia. Hello, PA Lydia.
Hey, hey.
We're going to embarrass you later. This is a show for people who would never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call 347-766-4323. That's 347
Poohhead.
Follow us on Twitter at Weird Medicine or at Lady Diagnosis. Well, okay. Or at Dr. Scott WM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you read with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Thank you. Thank you, Sherwin Sleeves, for the delightful opening.
Yes, thank you.
Check out stuff.drsteve.com for all your Amazon needs. 'Tis the season for shopping online. And you can get everything at stuff.drsteve.com. Just go straight through to Amazon or scroll down and see all the cool crap we have on there, including the Rode robotic. What? What's that face? The Rode robotic guitar tuner. If you know someone that has a bass guitar or a regular guitar or a mandolin, you did your mandolin on there. There's a bunch of different stringed instruments. It will tune it for you. You just attach it to the peg, and then you pluck the string, and it winds it for you. Have you never seen it go?
Crazy.
I'll show it to you in a minute.
Yeah, that's cool.
Mine's here somewhere. I don't know where it is. Scott's got it. And then tweakedaudio.com, offer code FLUID for the best earbuds for the price on the market, and 33% off if you use the offer code FLUID. Check out Dr. Scott's website at simplyherbals.net. That makes good stocking stuffers, a little fatigue reprieve or some peppermint nasal spray.
Yes, sir.
And then Chasey and I have a show on Patreon called, Weird Medicine. I guess the special edition at patreon.com/Weird Medicine. But we also do a type of episode called The Exam Room, where we have celebrities calling in and asking us questions. And boy, do we have a whale this week. We've got the biggest of the big. If he shows up, we've got the biggest guest that we've ever had.
Big if he shows up.
Yeah, I think he will. I think he will. And if he doesn't, we'll just keep teasing it until he does. But this is a big one. You're not going to want to miss this one. And he already gave me his list of questions he's going to ask, and they are doozies. So he's very naughty.
Oh.
Put it that way. Yes, he's a very naughty young man. So check us out, patreon.com/Weird Medicine. And if you want me to say fluid to your mama for the holidays, be they Christmas or be it Kwanzaa or be it Hanukkah or any other
Festivus
holiday.
for the rest of us.
Yeah, Festivus. Go to cameo.com/Weird Medicine. And really, over the weekend, I dropped the price to $3.99 just so I could do a bunch of them, and did a bunch of them. It was fun, and but
so
it's
we
still
made like $15 this weekend.
yeah. Ooh.
Hey, when you're making $0, $15 is a lot of money.
Yeah, I just do it for the fun of it. But I did go back to, it's like $9 or something, which means that on the iOS app, it's $9.99. So I didn't want it to be any more than $10. So I have to ratchet it down to $9, which they take a bunch. So look, I'm not making anything out of it. I just do it for the goof. It's just a goof. All right, and that's about it. You got anything else? Let's get into the show. All right, there we go. Okay, thank you. Let me just make sure something just glitched there at the end. Let me make sure it's okay. Okay, yeah, we're good. Okay. Cool. Are you guys going to go down and drink?
Go drink.
I'm going to pick up my baby girl.
Oh, you're not going to hang?
No, I'll hang for a few, but then I got to go.
Tacey likes hanging with you. So we like hanging with you, too.
We love Tacey.
You and Tacey, you should get that kid set up for a week or something. You guys go to Vegas together or something. You guys would be a great...
Don't say Vegas.
Oh, not Vegas. Okay, where could you go?
Vegas in December. I'm already dreading it.
Yeah, so you already had that.
Oh, okay.
Does he not? You don't remember
I've been
that?
there like 30 times, and now I got to go with Jim.
Take her to the Dawn.
What's the Dawn?
Oh.
Don Cesar at St. Pete. Oh, no, you'd like that.
Yeah.
Oh, you would love it. A direct flight.
We'll talk. Yeah, I think Tacey and Lydia need to be buddies.
She's wonderful.
Yeah, and really, I mean, we goof around. Lydia doesn't need to do anything.
No,
she's
I totally agree.
Freaking gorgeous.
Totally agree.
And her personality, she doesn't need boobs.
If you
But if she
can't-
had, oh God, she'll be a killer though.
Yeah. Oh yeah.
With
No, I agree.
she will destroy every man that she comes into contact with. And I think that is her purpose.
I think so too. I think it's payback. Payback, baby.
Yeah.
Hey, so we got a couple good suggestions.
And none of them that we know. And I promised that I would do some work on Radioactive because I was going to have chord progression over here and all that kind of stuff with these new machines that I've got. And I haven't done any work on it because I have no time whatsoever. What's the date today?
The 9th. Yep.
But we will actually play real music and play it well at some point before we die. Okay, what are we playing? And I do want to do the Israelites too.
You know what, this song, we're going to have to do the, I love it. I was practicing the one I sent you today.
What one?
Oh, for God's sakes. The Nationals.
Oh, yeah, I'll try that.
Oh, that fucking song. Yeah, I need a guitar, though.
You do? I don't think you do.
It sounds better.
Too much reverb.
Too much. So Lovett had a good one. She's
Yeah,
like,
what
how
is that?
about Good Old Boys, another Waylon song, because we're talking about the Waylon Jennings songs last week.
Well, we could do John Prine too. I'll do any John Prine song you want to do.
Yeah, let's do Good
Until
Old
we
Boys.
work up some. You were supposed to come over on Sunday, and I didn't see you. So,
yeah,
what happened there?
I think it was working.
Okay.
I mean, not working. That'd be
Oh,
terrible.
from the theme from the Dukes of Hazzard.
Yeah.
Oh, okay.
Let's
All right.
do it. Let's do it in G.
In G. Okay.
In G. should be if I can.
So
get it.
good old boy. What?
So good old boy should be just a good old boy. G.
Okay. All right.
Just a good old boy. Never meaning no harm. Beats all you never saw. Been in trouble with them. It's too low. Too low. Let's
Okay,
try
too
this
low?
one. Yeah,
Okay.
yeah. Let's do one. Let's go. Let's try
A.
Yeah, let's try A. Just a good old boy. And never meaning no harm. Beats all you never saw. Been in trouble with the law since the day they was born. How come I can't get down there today, Dr. D?
That's okay. Let's go up.
Kind of weird.
Let's go up to C then.
Yeah, let's go to C. I don't know why I can't get down there. Maybe the T. Just a good old boy.
There you go.
There you go. Never meaning no harm. That's better. Beats all you never saw. Been in trouble with the law since the day they was born. Okay, give me just a little more bass.
Really? It's so loud
let me
in
hear
my
it.
head.
Here we go. Let me try it now. Let me have bass. Yeah, that's better. That's better. Think so.
Okay.
All right, so we're gonna do a little good old boys in a C for you. Just a good old boy. I'm never meaning no harm. Beats all you never saw. Been in trouble with the law since the day I was born. Straighten them curves, flatten them hills. Someday the mountain might get 'em, but the law never will. Making their way the only way they know how. Well, that's just a little bit more than the law will allow.
Okay, I got it.
Got it. Just a good old boy. There you go. Wouldn't change if they could. Fighting the system like a two modern day Robin Hoods. Hell! All right, keep going. Let's do it one more time. Ready? Just a good old boy, never meaning no harm. Beats all you never saw, been in trouble with the law since the day he was born.
Okay, keep going.
Yep.
I forgot to give you reverb.
Oh, yeah, yeah.
There you go. There you go. Nice.
Yeah, nice, better.
Okay. Okay. 2. 1, 2, 3, 4.
Just a good old boy, never meaning no harm. Beats all you never saw, been in trouble with the law since the day they was born. Straighten them curves, yeah. Flatten them hills. Someday the mountain might get them, but the law never will. Making their way the only way they know how. That's just a little bit more than the law will allow. Yeah, just a good old boy, wouldn't change if they could. Fighting the system like a true modern day Robin Hood.
What the fuck is that?
Just a good old boy, wouldn't change if they could. Fighting the system like a true modern day Robin Hood. Yeah.
Is that it?
Fun. Yeah, yeah.
Or did you just fuck it up?
No. The weird thing is that there's one more verse on there that this version didn't have.
Making their way.
There you go.
Only way they know how.
There you go.
There's just a little bit more than the law allow, don't you know it? Well, they got the corn squeezings going. Okay, whatever. Anyway, what were you doing?
Oh, I love it. All right. Now that gets me fired up there.
Okay, now what do you want to do?
Now that gets me fired up. Let's do something little John Prine might like. Let's do.
Okay.
Did we do
Doesn't matter.
Doesn't matter. Yeah, I was trying to get something that you
I'll fuck it up.
Well, let's do Crazy as a Loon.
Crazy as a Loon.
In D. So the first kicks off on A, so it's back.
Yeah.
Back before I was dead up on the farm. I had a picture of another wife. Okay, yes, I think that's right.
Okay.
Yep. My mandolin is, I just am having trouble getting this one knee. I sound worse than usual. Sorry, guys. So, back before I was a movie star, straight off on the farm, I had a picture of another man's wife tattooed on my arm. With a pack of Camel cigarettes on the sleeve of my t-shirt, I'm headed out to Hollywood just to have my feelings hurt. Now that town will make you crazy, just give it a little time. You'll be walking round in circles down on Hollywood and Vine. You'll be waiting on a phone call at the wrong end of the room. Yeah, this town will make you crazy, crazy as a loon. So I headed down to Nashville to become a country star. Every night you'd find me hanging out at every honky-tonkin' bar. Every tune I met a woman, pretty soon she done me wrong. Pretty soon my life got sadder than an old country song. Well, this town will make you crazy. Just give it a little time. You'll be walking around in circles down on Hollywood and Vine. You'll be waiting on a phone call at the wrong end of a room. Yeah, this town will make you crazy, crazy as a loon. Go ahead and take it, Dr. Steve. So I gathered up my savvy, bought myself a business suit, and I headed to New York City, where a man can make some loot. Pretty soon I got out Monday morning, downsized that afternoon, overcome with grief that evening. Now I'm crazy as a loon. So I'm up here in the North Woods, staring at a lake. Better out a bunch of this old shit this old boy is gonna take. I eat fish to pass the time away beneath this blue Canadian moon. Yeah, this world has made me crazy, crazy as a loon. Yeah, this world has made me crazy, crazy as a loon. Finish up, Dr. Steve. That was good.
No, it wasn't.
Oh, that was much better.
You were good.
Oh shit! It always helps if we played something twice.
All right. Did you want to try that national thing, or do you want to just get out of here?
Well, let's try the national thing just for good old boys.
All right.
Okay. Let's
What's
see.
the name of that song?
Is Kish here yet?
I saw Kish.
There's Kish. What's up there, Kish? I just don't saw you. I don't know if he's been here all day long. Howdy, Kish.
Nope, I think he came in at 5:48.
Oh, we're keeping an eye on you, Kush. We're keeping an eye on you, big boy.
I had old Kush now. He's a good.
He's a good.
I'll tell you that.
He's a good.
Went up there in his market and bought me a soda dope. He surely is a good.
Oh my gosh, I love it.
All right, what's the name of the song?
What was the name of this?
Oh, for God's sake!
Oh, I know it. Now that you put me on the.
No, I got it. It's in my inbox.
What was it? Yeah, I think I sent it to you, didn't I?
Yeah, you did. It is called. I do not know.
Oh shit! I know what it's called. I've gone completely blank. But I do know the song. You know, and I will tell you this: if you want to do this, if you pull up the
hang on, I got it. Okay, it was no, I still don't know. Okay. Oh, I must have deleted it. There it is. Nope.
Hang on, it'll come.
This is going great.
Oh, for God's sake, Scott, what the hell's wrong with me? I actually looked at it today. Let's see. I'll find it, by God. My God, I know this is captivating, guys.
It'll suck, too. It's not even going to be good.
Oh, it's going to be good. It's going to be a good one.
But it's one of those that just has the same...
Yeah, what I was going to tell you... you can actually pull up the background. Here's Weird Goodbyes, for God's sakes.
I don't think that was it.
Yeah, no, it is, I promise. Weird Goodbyes.
Okay.
Yeah, Weird Goodbyes. Now, you're talking about the other one's Tyler Childers. That was White House Road. That's more of a bluegrassy song.
Okay. All right.
Now, we can do that. We can do the bluegrassy song, or we can do
No. I'll do whatever you want to do.
We'll leave it. We'll leave it to the people who have stuck it out with us all day long.
Oh, the one with Bon Iver. Okay, yeah. Okay, that's it. You were right. You were right. Now,
I'm
see,
sorry.
this one I really need to bring the keyboard in.
Well, what I was going to suggest, it actually has a background acoustic. It has the background instrumental on YouTube that you can actually play in our background. You can hear it, and they'll play that.
Yeah, we'll get a copyright strike.
Oh, yeah, they'll do it. Let's see. Kush. I can't believe Kush is late. Well, let's do it.
You
want to try it?
Yeah. You know how to sing it? I can play.
Yeah, if you'll here's the thing. It's if you'll just give me a boom, 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 because it's kind of the whole thing. But I want you to be able to noodle around. Can you get your little music box?
Yeah.
Yeah. See if it'll just give us just a 4/4 anything.
Yeah, okay. Shit.
Memorize the bathwater. Memorize the air.
Hello. Spam.
Memorize the bathwater.
All right.
Memorize the air. Come a time. I don't know when I was here.
Like that?
Yeah.
Well, that'll actually work, won't it? Yeah.
Memorize the bathwater. Memorize the air. There'll come a time when I was here. Names on door frames, inches and ages, and frets and concrete at the softest of stages. I don't know why I don't try harder. I feel like throwing towels into the water. Get it down to nothing. Everything that matters. Beavers, flashes, highly traffic, drastic patterns, humidity and history, chemistry and panic, swimsuits and windows of electric minivans. I don't know why I don't try harder. I've been going down some strange water. For now, there's nothing to do. Can't around, I can't follow you. Your coat's in my car, I guess you forgot. It's crazy the things we go. Oh, it finally hits me. A miles drive. The sky is leaking. When she's crying, keep on going back for more. No, keep going. My fucking computer just went out. All right, so, I'm sorry. Because I hadn't touched it. I was struggling. All right, so back to C. 3, 2, 1, memorize the bathwater. Memorize the air. The common time. I wanna know I was here. Like C, yeah, so. Names on the door frame, inches and ages, handprints in concrete at the softest of stages. I don't know why I don't try harder. I feel like I'm throwing towels into the water. Move forward now, there's nothing to do. I can't turn around, I can't follow you. Your coat's in my car, I guess you forgot it. It's crazy the things that we let go of. It finally hits me a mile from the drive. The sky is leaking, the windshield is crying. I'm feeling sacred, my soul is stripped. Radio's painful, the words are kept. The grief it gets me, the world goodbye. My car is creeping, I think it's dying. I'm pulling over till it is. I'm on the shoulder of lemon fields. Grief it hits me, weird goodbyes. My car is creeping, I think it's dying. I'm pulling over until it hits. I'm on the shoulder of lemon fields. There you go. Now that was awful. All right, guys, so that was awful. But
The grief it gets me, the weird goodbyes.
the weird goodbyes. Yeah, I
So
can
you
finally
playing
get
a
down
G
to that
there?
voice, yeah.
You have to play a G there.
Yeah. Well, okay.
The grief it gets me.
The way they play it in sound, that's not exactly how that's written. They just keep doing the same chord progression over and over and over. So in other words, they don't drop that.
Try that. Just play the C.
Which one? Where we were?
Just play the C.
Play a C.
And now play a G. And then play a D. Yeah, see, that's how it's supposed to go. So the second letter in there is the bass note.
No, I know. But what I was doing was, the outro. I mean, I guess what you could do is just the grief it hits me, the weird goodbyes. My car is creeping. Just hold the D. My car is creeping. I think it's dying. I'm pulling over until it hits. I'm on the shoulder of lemon fields. Yeah. Okay. All right, guys. Sorry about that, but that was fun. That was a fun song.
It almost has potential, and we can almost do something with that. But I think it needs to be at a higher key, so you're not just mumbling it.
I believe it.
Because you're like, it finally.
But that's how the damn guy sings it.
Yeah.
Yeah. I don't know. I was just kind of mimicking him best.
No,
I
I
could.
know. I get it.
Yeah, actually, that sounded better than when they do it live. Because
Really?
I listened to it live, it was awful. I was like, God, I sing it up. I mean, those guys
That's
are
funny.
talented, but he might have had a sinus infection or something.
All right. Well, thanks everybody. We'll put up something from this at some point. And we'll have Ebony back. She seemed very loads of fun, so we'll have her back next time.
So next time when we both forget what the name of the song is, you guys please remind us, because we'll both be sitting here going, "What the hell was the name of that
Yeah,
song?"
let's practice that though.
I love it, but the thing I love the.
Let's practice it so it sounds good though.
Yeah, but it's got a great little. Well, maybe after this you can turn on that.
Okay.
Yeah.
Okay.
So we don't get whacked. All right, ladies and gentlemen, boys and girls, everybody, thank you.
Oh, Bob Dandy, shut up. It's not. Fantastic sesh. It was not. It was terrible.
Bob Dandy's
Fun,
a good man. He's a good man.
We're just fucking around.
Thanks,
though.
guys. Yeah, you can tell we don't practice much. Kush, glad you showed up. Better late than never.
Yep. Oh, hey, y'all. Before you go, let me put a link for you. Hold on just a second. Most of you have already seen this, but let me get it. Don't go anywhere.
Oh, I know what the problem was.
What?
With the national.
Oh, you do? What
I'll
was
tell
it?
you a second. I'll tell you a second.
Okay, hang on.
After you finish your thing, yeah. I know you're doing something else.
But I would support you in not having the vaccine. There you go. That's 2-hour interview that Adam Goldstein did with me. And it was a 4-hour interview, and he cut it down to 2 hours.
Damn.
So if you
4
can stand
hours?
it, yeah. Oh my God!
Holy
And
moly.
he was like, and at 4 hours, I'm like, dude, it's been 4 hours. He's like, well, it's okay. I've only got about 30 questions left. I'm like, no,
Oh,
no,
fuck.
we're done. We
Fuck.
can maybe do part 2 someday. All right.
All right, boys. We'll say ends.
Thanks, everybody.
You get nothing. You lose.